Dr. Irene Kling is a licensed speech-language pathologist and vocalogist. She has years of clinical experience, specifically in stroke rehabilitation, voice, as well as transgender voice therapy. She is a adjunct professor at Adelphi University, in addition to having a private practice and treating a variety of clients. She brings a wealth of knowledge and experience to her profession, and we are so happy and grateful to have her join us today. So you have a variety of clinical experiences. Which one is your favorite and why?
I can't say I have a favorite. I mean, I seem to have, it turned out that I've specialized in two primary areas, stroke rehabilitation and voice. And voice includes working with actors and singers, customary voice users, and transgender voice users. So I guess you could say those might be my favorite, but I do, I like to work with people who have articulation problems, lisps. I've done a lot of work with accent modification in the corporate world, that kind of thing. I do like variety, but my practice seems to have become more focused in the last 15 years, I would say, in voice and stroke. And then I had many, many years at Rusk Rehabilitation at NYU, where I worked primarily with stroke and head trauma. And that's always been a very important area of work for me.
Right. One of the areas, as you had mentioned, is that you specialize in is stroke rehabilitation. And specifically, you work with those that have aphasia. What is aphasia? What are the different types? Is it a progressive disorder?
Well, typically, aphasia, if you want to, and I'm going to speak about this in a general sort of way, is a language disorder that is a result of brain damage that affects people's ability to understand and process what's being said to them, sometimes understand what they're reading, their ability to write, express themselves in writing, and express themselves in language, so that they may have word finding problems, a lot of difficulty accessing information at the time that they want it. And sometimes those problems are also part of an overall cognitive deficit, where attention and memory, concentration, focus, those areas also can impact negatively on language. There are many types. I think for our discussion, it's best to just, divide them into fluent and non-fluent. Non-fluent meaning that the person struggles both to find the language to express himself, to write that language, and fluent meaning that often the person is actually hyperverbal, but a lot of what is said has what we call neologisms, which are words that really aren't real words. And they struggle immensely with processing information. That's very characteristic of the fluent aphasias. When you ask about progressive, there is an aphasia called primary progressive aphasia, which is very difficult to work with because it keeps progressing, as the name implies. And very often, most of what we do there is work with the family, trying to maintain as much communication and the use of compensatory strategies as long as we can. And of course, people vary in how long, what this journey looks like, what the deterioration is going to be like, how slow, how fast. But it's a very difficult kind of aphasia to deal with.
Yeah, no, it sounds that way. And now, are there, and again, I'm just going to slightly just veer off some of these questions that you'll be able to answer them. Are there Is there a specific type of aphasia that occurs due to a specific type of stroke that has occurred? So a stroke in terms of the brain. So a stroke that has occurred on the left hemisphere or in the left hemisphere. What type of aphasia is more dominant to occur than if there's a stroke?
So a left-sided stroke generally has an associated right-sided paralysis or paresis, weakness of the arm and the leg. That aphasia often is a non-fluent aphasia known as a Broca's aphasia, where the language is quite limited in length. You won't see the typical grammar and syntax that you expect from people. And a right-sided stroke is often accompanied more with cognitive deficits and what we call dysarthria, where the speech production itself is affected, and you might see slurring of speech. The voice may also be affected and be more monotone, breathy, attention, focus. Those areas may be impacted, again, the cognition. So cognitive load is a very important part of how you work with people in therapy, not increasing cognitive load to a point where the patient is struggling. The affect on people who have right-sided strokes is sometimes affected as well. It can be more flat. Left-sided strokes can also be, very severe and cause what we call a global aphasia, which means that all the areas of language are severely impacted: reading, writing, talking, listening. But cognitively, those people are very often very intact, very alert, very oriented, and are communicative in all sorts of other ways. Drawing, gestures, vocalizations. And we encourage that in therapy, because with each patient you work, you want to find what is unique to that person's interests, personality, so that you can maximize the strategies that they use to communicate.
Right. No, absolutely. And now when it comes to treatment for aphasia, what type of treatment do you and other speech therapists use in order to help them with their deficits?
Well, again, most people offer individual and group treatment. The groups are very important because they provide socialization, support. They give people an opportunity to, work on their skills in a group context. The individual therapy, I think, needs to be tailored, again, to the individual. And the relationship that you have with the client, with the patient, is significant to the success of the therapy. Whether you're using the person's interest in flying, for instance, maybe the person was a private pilot before this happened to him, using that interest to stimulate language, using that interest to help him understand what's being said because he already has a frame of reference for that subject. So we use stimulation in any way that we can, depending on the severity of the aphasia, and again, depending on the person's educational background, what his linguistics ability were before. So the age, how sick or healthy that person is at the time that he had the stroke is going to affect his ability to attend and persevere. How depressed is this person? How much is that depression impacting on his daily life? Does he have people in his life who are significant others who can help and are actually contributing to the process? I always like to have the spouse in some of the sessions, because ultimately it's going to be the caregiver, whoever that happens to be, who is with that person most of the time. And you really almost want an assistant to what you're doing. And again, that means I'm going to be getting information from that person to help me tailor that therapy. So again, it suits this particular individual.
So, what resources are there for people who want to seek speech therapy, support groups? I know that, and we spoke a little bit about how, resources can be costly. What resources are there for, free or, a low cost,
Right.
treatment
Well,
or help?
at Adelphi, we offer not just the transgender services at no cost, but all of the services that we provide for other kinds of problems are at a very low cost.
Okay.
The groups are free. For instance, they have several aphasia groups that have been running for long periods of time. Those are free. But contacting the American Speech and Hearing Association is one of the first things that I would do, because they will, state by state, give you a list of people and places who provide the service that you're interested in. And then you can directly contact those people and find out, what they offer, what their costs are, what their services are that they provide. Yeah, that's the first place that I would go.
Okay.
Because it's our organization. Yeah.
Absolutely.
Yeah.
And now, and I guess this is more in closing, but what advice would you give to somebody who's struggling with, a stroke? They've just, they now have aphasia or voice disorders, or a loved one who is, dealing with somebody that is speech and language impaired or voice impaired too?
When you say what advice, do you mean in terms of their day-to-day life or seeking help or?
I would say day-to-day life and then also seeking help.
I think it's very important to seek therapy very early. Okay. Because there is a period of spontaneous recovery that people go through when they've had a stroke, where progress is very, very rapid, and you will see a lot of changes, which is very encouraging. We know that changes occur forever. They just get slower and smaller, but they continue, because as people develop compensatory strategies, they get better and better and better at using them and then functioning, more in the context of what they're used to. So I would say do it early, get help early. And very important that the family be included in whatever treatment decisions are being made, that the therapist be there to provide information for you, that you have an opportunity to counsel the caregiver, even without the client being present. Because, often a spouse or, a child, a daughter or a son won't want to say certain things about what's going on that are difficult for them to cope with while the mother or the father are present. So it can be very useful to work with the therapist that way as well, without the patient present. But I think you have to know, very specifically what's going on in each individual case to say what the person should do at that time.
Right. I think that's great advice. And now for people, since you are treating people still, who are interested in the New York, they're in the New York City area that want to come and do speech therapy with you, how do they find you?
Oh, well, they can find me through
your website, right?
My website is, if you put in Irene Kling, my website comes up.
Okay.
Yeah, and or they can email me at kling at adelphi.edu.
Okay.
And I will answer them.
Perfect. Sounds good.
Yeah.
Well, thank you. This was wonderful. All righty. Take care. Be well. Okay. Bye.
Bye-bye.